views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hola everyone, welcome to Open BxRx Remote, brought to you from my living workspace, Chari Executive Suite. I'm Rhina Valentin, your hosty Café con Leche every Friday. Here's what's coming up in today's show. Leading things off, we shed light on HIV/AIDS awareness as we discuss the impacts of COVID-19. After that, we'll find out about the annual Holiday Hope Toy Drive for children in low-income housing and shelters throughout New York City. Then we'll speak to Christine Osoria about the inspiration behind her new children's book, Rosalia, the Honduran American. Later on in the show, Bobby C brings us an up-to-date with the latest headlines in the world of sports. Lastly, this week's Open Artist Spotlight features musical artist and The Voice Season 15 contestant, Zaxai, who will perform for us later in the show. So sit back y prepárate. All this and more is headed your way because now we are officially open. Welcome to Open. I'm Rhina Valentin, your hosty Café con Leche for the next hour, encouraging you to get social with us online as we continue during these social distancing times. Let's connect. Tweet us and follow us on Instagram at BronxNet TV or like us on Facebook at Open BronxNet Television. And you can always follow me on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. In our new monthly segment brought to you by Essen Health Care, we will be providing knowledge related to health advocacy as we continue to deal with this pandemic. Let's get into our dose of essential medical information. In today's essential segment, we focus on HIV/AIDS awareness. HIV/AIDS continues to be an issue in the United States and around the world. According to the CDC, in 2018, an estimated 1.2 million people were living with HIV in the United States, and 14% of those people were unaware they even had it. Joining us to tell us more about the disease, please welcome Essen Health Care Primary and Urgent Care Medical Director, Dr. Silvio Goris. Hello, Doctor.
Hi, thank you for having me.
Thank you for being here. Welcome. Let's open up by establishing your role within Essen Health Care. I understand you recently became the medical director last year. And let's just talk about Essen Health Care's purpose within the borough and also the locations and how they're situated and where they're situated.
Of course. So Essen Healthcare is really located throughout the Bronx. We have 28 offices between urgent care and our primary care, 15 urgent care sites and 13 offices. They're located all throughout the Bronx. The idea is that we can offer different care points to patients all through the Bronx to have access to primary care, their urgent care needs, also any specialty service that's required. The goal is really to be able to introduce better health habits to all of the population of the Bronx. And as an underserved area, we're aware that health education, health literacy, access to health are very big issues that we face here in the Bronx. So our goal is really to be able to remove some of those barriers by offering these services.
And so what location are you based out of?
So from urgent care, we have multiple locations, which, we do rotate through these locations throughout the whole Bronx. From primary care services, I do work at 2445 Arthur Avenue. That's going to be one of our locations based out in Little Italy in the Bronx. Very friendly environment. I love it there. It's very nice.
Well, thank you for sharing that. It's important to love what you do and love your environment as well. And so what are the most common reasons, let's say, or purposes that a person would visit Essen Health Care?
So we have multiple services that we offer. In our primary care side, we do continuity of care for different medical conditions, including high blood pressure, diabetes, cholesterol issues, patients coming for annual exams, and just routine checkups to make sure that that everything is okay. Like you mentioned previously about the 14% of individuals with HIV that weren't even aware they had it. So we do believe that having access to routine care is very important. So we're very big on preventative care and offering services to patients to assure that all of their needs are met.
And so, this past Tuesday was National HIV AIDS. Well, actually, it was World AIDS Day, and so with that awareness being brought to the world, what would you say would be a reason that one should consider being tested for HIV?
So, I mean, there's many reasons. One, just knowing that it's there, it's definitely a benefit because there's so much more resources now and so many more treatments now that people can actually go and be treated and go as undetected with adequate CD4 counts and really not have to worry with a lot of the complications that we used to see in the past with HIV. So given the advancements in medicine, it is very important to get tested early because now we can actually treat and be more effective in our treatments. Also, with the pandemic of COVID-19 and just the immunocompromised population that have higher risk for complications, it's definitely very important to understand what your risks are in these times.
And so, I also know that you spearheaded um, the COVID-19 care program for Essen Health Care, which included pre-care, post-care, and monitoring of systems of thousands of patients in the Bronx. When it came, or when it comes to individuals with compromised immune systems, like how is that handled any differently?
Definitely, we definitely place a greater focus on patients that have any immunocompromised state. We want to make sure that we can give adequate follow through of care. A big portion of COVID-19 care was testing. So, then we were faced with the dilemma of, when we have these positive tests in patients with immunocompromised state, what do we do? How do we handle these patients? What's the best care that we can offer them in an outpatient setting to try to avoid any need of escalation of care, of ending up in hospitals, intubated in ICU. So we were able to team up with our group of specialists. We have infectious disease doctors, a pulmonologist, cardiologist, and as a group, we were able to come up with different systems to put in place to assure that they were getting adequate follow through, that they were being seen on time, that they were getting their medications on time, that we were identifying any possible barriers or complications that they might be facing, and that we were tackling them, in that given time period.
And so, somebody has this compromised immune system and or is diagnosed with HIV, how often should they be getting tested? And in addition to how often should they be getting tested, what kind of symptoms should they be looking for? Do the symptoms for COVID apply? Are they differently affected or rather, do they differently affect a person who has a compromised immune system? Is it, should they be waiting, excuse me, I'm trying to be very clear in my questioning. Should they be looking for the first sign as opposed to waiting and having symptoms?
So I would say we do know that a lot of the patients with COVID-19 have been asymptomatic. So it's a little bit hard to say what would be the first signs and symptoms. I would definitely say if they have any fevers, cough, shortness of breath, fatigue, any signs of any viral illness, it is important to be tested, just so we can give adequate follow-ups if COVID-19 is positive, or meaning if they do have the COVID-19. What I would say is, it is also beneficial for them to, maintain their social distancing protocols and really, not be in environments that might pose a higher risk, such as, different medical care centers, unless it's needed. I would say that the biggest issue that we would see or we would face is more of, their risk of complications due to COVID-19, not so much of their initial presentation or symptoms that they're seeing. So ideally, if they are positive, we want to definitely be able to give them close monitoring after identifying that positive test, because their risk of getting complications, whether that's respiratory compromise, whether that's hematological compromise, with, we've seen a lot of patients with DVTs and pulmonary embolisms, is going to be a lot higher than the regular population given their immune state.
So I also am aware that Essen Health Care offers telemedicine. So does an individual have to be present first before receiving that type of care, or can a person make an appointment, or do they need to do you accept walk-ins, and or do they need to have an initial file within Essen Healthcare, or could like their hospital files be transferred to Essen Healthcare? What is that system?
We definitely accept walk-ins. We definitely want to open our program and services to everyone in the community. We don't really want to put more barriers or limitations. We understand that with COVID-19, a lot of medical centers have been closed, or just the access to care has been very limited. So we want to be able to offer as much access as possible, whether that's through telemedicine. It's as simple as going onto our website and booking an appointment with primary care team or specialty team, or calling our patient care center and getting an appointment booked. There's no need of having been previously seen or tested in one of our locations or having any files with us. If there's a need, we want to be able to meet that need and help as best we can.
Wonderful. Thank you so much. With us here today, Dr. Silvio Goris, and thank you for all your knowledge, and thank you for your service.
It's my pleasure. Thank you for having me, and have a wonderful day.
You too. Thank you. All right. Once again, you guys, for more on Essen Healthcare, you can visit essenhealthcare.com. We do have to take a quick break, but when we return, we'll hear about an annual toy drive for the holidays. Don't go anywhere.
Bronxites gathered at the Church of God Prophecy for the launch of the Bronx Flu Fighters campaign as part of the influenza vaccination month during December.
Especially with COVID-19 happening, it's really important for everybody to be protected, and the more people who are protected, the more people get vaccinated, the more people who are protected.
This year, as the flu season approaches during the COVID-19 pandemic, the urgency to get the vaccine has become a priority across the city.
We need you. We need you to go out and get that flu shot if you haven't done it already.
An initiative starting this year and funded by the CDC, the Bronx Health Reach is working with several churches and senior centers across the borough to ensure residents get their flu shot.
We think it's really important right now, more than ever, to make sure everybody receives their flu vaccine, and just so we can keep people who have the flu out of the hospital and save those resources for COVID-19 patients.
Pastor of the Church of God Prophecy, Earl McKay, has been at the church for 30 years and tells us this flu vaccine campaign has been a great help in addressing the health disparities in his community. However, there are still some members of the congregation who are wary of the vaccine.
Quite a number of folks are afraid. They're not sure if they should take it. So it really takes some convincing that this is a good thing. And that's one of the challenges, getting our folks to understand that the flu vaccine is safe.
Now, Bronx Health Reach tells us that they will be hosting flu vaccinations at various churches throughout the month, and they also tell us that organizations that would like to set up flu vaccinations can do so by reaching out to them. Reporting for BronxNet, Jericho Tran.
Hey everyone, and welcome back. The holiday season can be really tough for many families, especially during this pandemic. And so our next guest is holding her annual Holiday Hope Toy Drive that will give kids in New York, lower income areas, and city shelters a gift for Christmas. Joining us to tell us more, please welcome New York City Council District 12 candidate and founder of I Raise Boys and Girls International Corporation, Shaniqua Moore. Hello, Shaniqua, and welcome back.
Hi, thank you so much. It feels amazing to be back and to just talk to you all more about what I've been doing in the community.
Well, congratulations on your candidacy.
Thank you. Thank you so much.
That's an interesting, well, from the last time we spoke and had you on, we were discussing all of the services that you offer through IRES Boys and Girls. And so now that you're running for a council, it's quite, remarkable. So congratulations on that.
Thank you. I appreciate that. I feel like we definitely need a woman representation up in the North Bronx, and having that diversity is very important and essential, especially in my district where there are so many women and so many mothers. And we know that when there are women in office, we get the work done and we bring that diversity that's needed.
And so the reason I even brought that up is because here you are running this organization that caters to the next generation, and now you're running for council. And in addition to that, you're still holding these annual toy drives that you're presenting, that we're presenting today. And yet, there's still a lot of work that needs to be done. So what is your drive and what's the motivation behind you making sure that those underrepresented and those underserved are taken care of?
That's a great question. I want to start off always by telling my story. And many people don't know this, but I actually am a child that was in a shelter system when I was a kid. And so I firsthand have witnessed what it's like to struggle and to be in poverty, and to grow up with a single mother of six other siblings. And that in itself is what really drives my passion, is me going through certain systems and seeing that there was a need for some kind of support and services like the ones that I'm able to provide today. And so I also say my mother has been an inspiration throughout my life, her just instilling morals and values in me, and all of that just driving my passion to make sure that people that are underrepresented, that they have a voice that's amplifying their voice. And that really truly is what I do, and the heart of why I do what I do is to amplify the voices of those that are vulnerable, those that are often underrepresented or misrepresented, and to make sure that they're not forgotten and that they're not neglected, which often happens in our society. And so that's all I want to do, is to be able to be there for my community in every way that I can.
That's amazing. Thank you for sharing your truth with us here. That really is. How long were you in the shelter system and what age were you?
Actually, I was born into the shelter system. I want to say into the age of 5 years old. I remember very clearly when my mother got her first apartment. I was 5, it was right on 161st Street in the South Bronx. I'm a Bronx native, so the Bronx is all up in my blood. And so I was in the shelter until 5 years old. From there, my mother was able to get her apartment, get stable housing. And thankfully, she worked very hard to make sure we continue having the stable housing that we needed.
That's wonderful. And, it totally makes sense what your corporation is and what your corporation represents, because you're definitely conscious of the next generation in all the work that you do. And you're a true inspiration. I really appreciate you sharing this truth and being authentic with us here on air. That's amazing. Yeah. And so doing this toy drive, it holds a lot more purpose for you, and it really is meaningful to you because it's something that you've experienced, so you know what their needs are. So let's talk about the toy drive now.
Sure. So every year I host a toy drive right in my community in the North Bronx. So this is the 8th year that I've been hosting it. It's normally hosted under my nonprofit, IRES Girls and Boys. My nonprofit, which is its own separate entity, is still holding a toy drive. I will be also holding one under More for District 12, which is my campaign. And really, I will be targeting 3 shelters in the North Bronx, as well as targeting kids that reside in public housing. We will be providing toys based on the ages and gender of each child. Parents will be able to sign up on my website, which is very simple. It takes about 1 minute to complete the form. They'll just put their kids' information, very basic information, so that we're able to provide the right toy for their child. I think it's always something magical when you tell a child that they're not forgotten and that they're special. And it gives them warmth in their heart, and it brings hope and a smile to their face. And that's really what it's about. It's holiday hope. It's giving hope to our kids when they've gone through so much this year with COVID-19. And just really reminding them that they matter and that I see you and that you're important. And the other part of the toy drive is we're actually going to be distributing the toys at Eastwood Manor on December the 16th from 2 p.m. to 5 p.m. And their kids will be able to come pick up their toy. The parents will have to wait outside, but the kids will be safe with our staff. They'll be able to pick their toy up, and they'll be able to take a picture with Santa and get a nice to-go food box and be on your lovely merry way. And we'll be doing that for every parent and child that signs up for our toy drive.
So just to be clear, I want to be clear. So there's a form that people would need to fill out on the website to receive the gifts, and there's a form for people who wish to donate gifts on the same website.
That's correct. Both forms. So if anyone is interested in donating and giving hope to a child this holiday season while you're shopping, whether for your own kids or your family, and you just want to pick up a nice gift for a child that's in need, you can definitely fill out the form on our website. It's very simple. It is, again, about 1 minute to fill it out. You just give us your information. With COVID, we just want to make sure things are safe for our kids. But absolutely, you can go to my website, which is www.moreforddistrict12.com, and fill out that quick online form, and someone will get back to you within 48 hours to process your toy donation request.
And so are there a limited amount of gifts, like how, because a person needs to be registered in order to receive a gift, right? So in other words, they have to go and fill out this form in order to qualify or to get the gift for, and have that pick with Santa on December 16th?
Yes, that's correct. So it's one gift per child. It doesn't matter how many kids are in that family. I know some families are larger. We will accommodate the family sizes. Right now, we do have about over 100 kids that are signed up in a few local shelters, and the ages are ranging from 3 months old to 8 years old. And so, you know, the parents, some parents have already signed up for it and we're already accommodating their request. So again, you know, we will accommodate the request of the family. We know that some families are larger, and that's absolutely okay.
All right, so once again, just to repeat, you're still accepting donations, and so everything's going to be on the same website, which we're going to direct you when we're done with this interview. But the idea really is for us to encourage those who are in need to reach out and just fill out the form now, because it is on a first come, first served basis.
That's correct. And if there's issues with technology and they are not able to get online, they can give us a call at 929-900-5952. I know that some families may not have access to Wi-Fi. If they don't and they just want to call, they can absolutely give us a call, and we will take down their information for them.
So I just was trying to write the number down really quick. It's 929-900-5952.
Yes, correct.
Wonderful. Shaniqua, do you have any last words for our viewers and for those who may be looking for just a pinch of hope in this holiday season? I mean, I think we're all looking for hope, but for those who may not see the rainbow at the or the sun at the end of the rainbow.
Yeah, I think that we just have to continue pulling together as a community. We've come so far and we have a lot more work to do, but as long as we can come together and continue remembering each other and uplifting each other in unity, I think we'll get there. So I know during the holidays, these are times when a lot of people feel depressed and a lot of people may not feel so good. And, you know, you could always reach out for help. I also run a nonprofit, I Raise Girls and Boys. We do run parent counseling, counseling for children. If you ever just needed to reach out and you just needed some help, someone to talk to, we are here for you. I'm always a listening ear. I like to sit with people from my community all the time and just talk. So I'm always open to listening and to helping in any way that I can. And just want everyone to know that I absolutely love my community, love all the children and all the parents and families. And I'm just happy and so blessed just to be a part of our community.
Woo, thank you. You are a beacon of light, Shaniqua Moore. And congratulations once again on your candidacy. And you guys, to donate a gift and or to receive a gift, all you got to do is visit moreforddistrict12.com/events. And that's for the forms, the scheduling, the drop off, and location. All right, we have to take a quick break, but when we return, we'll find out about a new children's book celebrating Honduran culture. Don't go anywhere. Welcome back. Our next guest is a mom of three, a wife, an empowerment and business coach, motivational speaker, and now an author of a new children's book titled Rosalia, the Honduran American. The story follows a young girl who struggles to understand why her classmates have not heard of the country Honduras after being assigned a project. And joining us to tell us more behind the inspiration of the book, please welcome Christine Osoria.
Thank you so much for having me.
Well, thank you for being here with us. And I, first and foremost, we are all aware that Hurricane Eta has affected Honduras. Do you have family members over there? Is everyone okay?
Yes, we do have family members over there. My mom, my family, my cousins, everyone is doing fine. We did have my father's friends who had to evacuate, but thankfully they were able to go back home. So at this current moment, from what I'm aware of, a lot of family members are okay, but there were a lot of friends and outside of where my parents are originally from, they were impacted very hard with what was going on.
And so I know there's a lot of efforts being made with regards to donations. And so is there any place we can suggest people donate to?
Yes, actually there's a lot of places. There's Delsey Shipping, they're based in Queens, but there's also a lot of places in the Bronx, the Garifuna Market. I know it's one that have been, they promoting a lot of, help within the community. There's the Bronx's Reading has also posted stuff online with different organizations. And I try to keep up with as many, but I do keep up with the Garifuna Market, I will be honest. And Central American Voices is other places that people have been posting of places where you can donate. With my family, we're doing our best to try to ship something as soon as possible. But I tell everyone, if you can please donate to an organization that's available near you, please do that, because that is important at this moment. They can get any help that's needed.
Absolutely. Honduras needs our assistance. And so thank you for sharing all those options. And with that, I'd like to allude to just you and your self-identity of possibly rediscovering yourself with your cultural background. You identify as a Honduran American, which assume means that you're born here. And the question becomes, in writing this book, is it something that you learned of or developed in as time passed versus like one day you had an epiphany, like, oh, I'm different?
Yeah. So that happened to me, honestly. And I think it became more as I was a teenager. I realized it came to me a little bit when I was a young child, elementary. I will say I was born and raised in the Bronx. And where I grew up, I'm from the Kingsbridge area. So where I grew up, there was a lot of Puerto Ricans and Dominicans and Mexicans. But I guess I didn't really realize that I was different. It was more when I went into high school. I went to Grace Dodge High School, vocational high school. And I started realizing that I was one of maybe 5 in the graduate class that's from Honduras. And it was I guess it was very eye-opening to me as a teenager that I am different, that I'm not, you know, I'm not Puerto Rican and I'm not Dominican, you know? So it was, that's when I really had my wake-up call, and more when I had my children. Again, I'm a mother of 3, and my kids are Dominican Honduran. And we, during school time, you know, when they were asked where they're from, they had told me themselves, Mom, when I tell people I'm from Honduras, nobody knows. They know Dominican Republic, but they don't know Honduras. So that was, again, another wake-up call for me. It's like, wow, like a lot of people don't really know about the country Honduras and where it is, and, you know, who we are.
So in your book, like, what cultural jewels do you provide within the discovery of just, I guess, educating individuals of things that represent Honduras?
Yes, I actually, in the book, it's about a young girl called Rosalia. She's in class and she had to do a project, and she specifically chose Honduras, where she's from. And she talks about the country itself, you know, the Honduras flag, what represents the star. She talks about the food, and she talks about the music. So that is something that I put inside the book, that I wanted the reader to understand our culture, but to also to understand that there are many different children out there with many different backgrounds. And we should acknowledge and also be proud of our culture and not be ashamed of our culture. That was very important for me while I was writing this book. You know, to tell children everywhere, like, if you're that one Honduran in the class of many other Latin American countries, like, be proud of your culture regardless of who's around you. So, but to answer your question, yes, I did put it in the book, who us Hondurans are, the language that we speak, the food that we eat, the music that we play and we listen to. So that was really important for me to put that in the book.
So you wrote the book in English and in Spanish.
Correct.
But I also understand that in Honduras, and help me understand, like, what differentiates, like, somebody who identifies as being Honduran and being Garifuna? Because Garifuna has its own language as well.
Yes, they do have.
That is Honduras.
Yes, that is so true. Honduras, sorry, we do speak Spanish, but there are many that speak Garifuna. Now, I would say this: I do not know Garifuna because I grew up within the Spanish community. I do have friends.
But Garifuna is also a folkloric language, right?
Yes, yes. So I tell, like, when it came to Garifuna, I'd be honest, I listen to the music, I listen when the music is played, but I do not understand it, I do not speak it. I do have many other friends that are Garifuna, and I do hope that they share their story, right? But yes, there is Spanish and Garifuna, and, you know, it's a mix, obviously, of languages, like many other countries.
It's awesome because it's 3 languages.
Yeah. So, you know, it's like many other countries, like many Latin countries, like they speak more, not just Spanish, but something else. So yes. And, you know, there's many people that speak Garifuna. Unfortunately, I can't. And
okay. You help me understand a little bit more within the 3 languages that are spoken in Honduras. And I wasn't sure if you discussed that or mentioned that within the book.
I didn't. Because honestly, I will be very honest, like, the book is really a little bit of my story. I shared a little bit of, yes, we do speak Spanish, and there are many people that speak Garifuna. I didn't get very into detail about the Garifuna. I do hope that one day that someone does share that Garifuna part, being Honduran and being Garifuna. I think that's so important. But in this book, I just spoke more about culture, and I spoke a little about Honduras, and who we are and our music. So
beautiful. Yeah. No, it's great. It's great. And so before we go, the age range for the book?
Yeah, so the age range is between 5 and 10. But I will be honest, I've had many adults from different backgrounds tell me that they enjoy the book themselves, because many of them did see themselves as Rosalia. in being in school or in workplace and not knowing, a lot of people not knowing, where their country is from or who they are and, their background. So that was very important. That was very actually shocking to me that so many other people, as well as children and adults, can relate to Rosalia.
Well, yeah, it's important for us to know where we came from, to know where we're going. And thank you for making it your business to not only self-identify and dig deep into the roots of your origins, but to put it in a book form so that the next generations to come can have that as a means of a reference. So thank you, Christine Osoria. Osoria, right?
Osoria.
I just want to make sure. And you guys, once again, Rosalia, the Honduran American, that's the book, can be purchased on ChristineOsoria.com and or on Amazon. All right, don't go anywhere. Bobby C's Weekly Sports Roundup is coming up next.
The holiday season is all about giving, and the New York Football Giants have been in a giving mood lately, folks. They've been giving Big Apple fans victories, wins to the tune of first place in the NFC East. Who would have thunk it? The latest, a 19-17 win over Cincinnati last weekend. Only downside from the win, quarterback Daniel Jones is banged up and could miss time with a bum hamstring. The 4-7 G-Men are in Seattle Sunday. We go inside the locker room for more.
I don't think you can compare this year period to any other year. Every team's unique. Every situation is independent of another one. However, I am proud of the way our players are working. I'm proud of the improvement they've made. I'm proud of how they come to work every day with a mindset of improving and going forward. We don't make it easy on them. That's by design, but I like the way they respond to our coaching. I like the way they respond to adverse situations within games, which obviously showed up today in several, situations. They respond in the right way, and we get the results we needed.
You always have to be prepared, be ready, and it felt good to get out there and call some plays and execute. There's a few I'd really like to have back, but always thankful to get a win. I thought the defense played outstanding today, kept us in it.
Good defenses travel. We got to pack it up on the road and set the tone. It doesn't matter what the offense is doing. We got to get it done on defense, and a lot of us are on defense a lot of us are on kickoff. On that kickoff return, a lot of defensive players are on there, so that's on us to make it up. And we're just trying to hunt the ball, play good defense. We were able to get it out in the second half and really hold on to that one.
Great to see them in first, albeit in a weak division. I can't believe this late in the season we were talking about the Giants and even a team like Dallas being sub 500. Still, some tough contests coming up for the Giants. After Seattle, they have Arizona and Cleveland on the schedule. Meantime, the only thing the Jets are winning these days is claim to the upcoming #1 pick in the NFL Draft. Despite the return of QB Sam Darnold from injury, Gang Green lost 20-3 to Miami last weekend. The Jets are 0-11, but winning the Trevor Lawrence sweepstakes. That would be some prize and perhaps the only bright side or positive thing in a lost season for the Jets.
It's frustrating because I feel like we're right there. We got to make one or two plays, and especially this last game, it's right there for us. And there's been multiple games like that, and it's frustrating for myself, all the players. I know the fans.
In college football, another impressive weekend. Alabama and Notre Dame are the obvious two top teams in the rankings as the regular season turns the calendar to December. #1, Alabama had a smooth Iron Bowl win against Auburn with an interim coach in place of Nick Saban, who was unable to spend Saturday with the team after testing positive for COVID-19. The 42-13 victory included another banner day from quarterback Mac Jones. Jones threw for 302 yards and 5 touchdowns. Meanwhile, number 2 Notre Dame turned the tables on North Carolina after a fast-paced first quarter that seemed to play into the Tar Heels' favor. Instead of engaging in a shootout with an opponent more than happy to run at a high tempo, the Irish slowed down the pace. Notre Dame smothered UNC for a 31-17 win. Speaking of smothering, internet personality Jake Paul looked like Mike Tyson in his boxing match with former Knick Nate Robinson. Yikes. Now Paul is feeling himself more than usual, too. Paul is already challenging one of the biggest names in the fighting community, and according to the YouTube star, it's going to happen. Paul took to Twitter shortly after knocking out Robinson in the second round of their bout at the Staples Center in Los Angeles on Saturday night to call out UFC champ Conor McGregor. Paul wants a future fight with Conor. Yeah, I doubt Paul wins that one, but you never know. I do think Mr. Tyson himself, though, he did win his exhibition match that same night with Roy Jones Jr. Tyson and Jones Jr. got into the ring at a combined age of 105 years old, and it wasn't bad. It wasn't scored officially, but the celebrity judges from the WBC saw it as a draw. Tyson really won that fight, folks, and he's still arguably among the best draws in sports today. Each of the legends walked away with over $1 million, and it could lead to further matchups for the pair. Even talk now of a rematch between Tyson and Buster Douglas, 30 years after Douglas upset the former heavyweight champ. Giving wins or knockouts is one thing, all jokes aside. Giving back, truly giving back, is another. Yankees general manager Brian Cashman participated in the Covenant House Sleep Out in November. While Cashman found himself sleeping out on the field at Yankee Stadium, the more than 1,400 participants came together virtually for a night of solidarity and fundraising to support young people facing homelessness during the COVID-19 pandemic, right here in the Bronx. Participants were able to sleep out from anywhere: backyards, porches, terraces, garages, kitchen floors, etc., so long as it was safe and legal. The Sleep Out's mission is to raise urgently needed funds for Covenant House, spread awareness about the youth homelessness crisis, and send a powerful message.
Where we are, there are kids that need our help. And so the Sleep Outs are one vehicle in our fundraising efforts, but it's really our most important vehicle that has the most impact. And now in this COVID pandemic that we're dealing with, the funds are even that much more necessary than ever. We're definitely, without a doubt, every dollar raised in this effort is saving lives. It's making a difference in kids that have no chance. And Covenant House is there to give them hope, give them shelter, give them an opportunity and direction and structure, and get them on their feet and give them an opportunity that, for a lot of reasons has been denied from them.
That's a win for Cash, the Yanks, and the Bronx. Still more work to be done in that regard, and there's still more work to be done in Metsville. We caught up with Sandy Alderson, who is back with the Mets this year, looking to rewrite his legacy for the Amazons.
I think we have an excellent foundation, but I think that, our needs are multiple at this point, and that, we're more than a player away. Now, who that player is, what position that player, plays. I think we've got some flexibility there in terms of how we address things. You're not going to address everything necessarily in the same way. We want to, check all the boxes, but at the same time, we're going to be focused on where we can best improve.
NBA training camps began this week with individual workouts Tuesday. The New York Knicks will play a 4-game preseason schedule this month, where fans are excited to see Brooklyn's Obi Toppin, the team's first-round pick. Toppin will have no summer league or voluntary scrimmages under his belt because of the pandemic, but has been practicing for months and looks ready to go. Kevin Durant appears ready to go too. The Brooklyn Nets star is coming off an Achilles injury that kept him sidelined for the entire season.
We know what good basketball, championship level basketball looks like. So it's all about crafting every single day with the group and, coming together and seeing what's the best way for us to play. It's still early in the season, and, it was COVID and guys have been separated all summer and doing their own thing. So, it's going to take some time for us to figure out the best way for us to approach this thing. But we're looking forward to that challenge.
We'll focus on what we can control. We'll focus on our group and put all the energy we have into this, while, like we said, remaining fluid as possible to all the different possibilities in these strange times. And we got to enjoy it too. So we'll keep building, and we'll keep pushing our guys and challenging them, and we'll build something really good.
We could be turning a corner in the pandemic too. We hit the C list for more on that. Normalcy, in more ways than one, eventually will return from COVID-19. For the NFL, that could happen by next season. At least that's what Dr. Fauci thinks. The director of the National Institute of Allergy and Infectious Diseases told Yahoo Sports that pro football could see crowded stadiums by the start of the 2021 campaign. The numbers, of course, still aren't great, but the vaccine appears on the way. It's possible that stadiums will be full for some teams in some places, and that other stadiums will remain empty, or at least closer to empty than full. The best news comes from the impending arrival of vaccines, even if it's still unclear how anyone will convince those who refuse to put a mask onto their faces to put a needle into their arms. Wear those masks and keep it locked to BronxNet for all the latest updates right here in the Big Apple. Stay safe, stay healthy. That's your look at sports. I'm Bobby C.
Welcome back. Our last guest is a Haitian American singer and songwriter who made his first television appearance right here on Open in 2017. And since, he's been featured on NBC's The Voice season 15 and made it all the way to being part of the top 24. And now he's back to tell us about his upcoming projects. Please welcome Zaxai.
Rhina, it's such a pleasure. Thank you so much for having me.
Oh my gosh, welcome back.
Thank you for having me back.
I mean, it's not in studio like we had to the last time. However, I will say I am always thrilled to know that we were that platform that showcased an artist for the first time and or gave them their wings, right? And, and then take off, and then boom, all the way to NBC, top 24. Unbelievable. Congratulations.
Thank you so much. I mean, to this day, it's still on my Instagram channel because for me, it was super huge. I don't think I've ever done anything televised. And, you brought me on board. I had a big bright red jacket on, and I just said, you know what, I'm going to give it my all. And then from there, The Voice and then other televised programs. And so for me, this is home. And it was so cool, too, because I was born and raised in Brooklyn. And to get this, to receive such Bronx love was just epic.
I love it. I love it. Really, it truly warms my heart. And it's lovely to bring you back, especially during this holiday season. We continue to showcase artists. Obviously, we're bringing you aboard, which right now our artists, the artists need a lot of love right now. And I'm hoping and trusting that even though we're dealing with these circumstances, you've been inspired to continue creating and producing and writing and just writing the next hit.
That's actually exactly what I've been doing. I mean, at the beginning of COVID, I did feel some type of way. I thought to myself, well, is this a break? Is musicianship going to continue? Many of the venues in New York City closed, but then, we're hustlers. We come out of New York City, we grind, we tough it out. And I said, well, I guess we're going to have to figure something out online. And hence the mic and the guitar in hand. And I figured it out. And I released three singles throughout this duration of COVID. And I plan on releasing a few more. So 4 singles, actually. Oh, wow. But yeah, so it's just been an awesome grind. And it's taught me a lot about myself as a musician, but also as an artist.
So just walk us through a little bit of what your story looks like, you know, as briefly as possible, right? Because we could be here all day, and I'm totally interested, but we don't have that time for this particular segment. However, I'm very curious to just hear about like all the hoopla that occurred after appearing on The Voice, and how that opened up more doors for you, and where you went off to after that, and how everything just came to a halt because of the pandemic.
Oh man, as soon as The Voice ended, well, first and foremost, I already knew New York City. Let's try to use that to the best of our ability, you know? So I went to a few countries. I went to Norway, I went to France, and just did like a little cool international gigs, one-offs on my guitar. I did a few concerts at Rockwood, the Blue Note, Glory to God twice. Just a few things. Released an album called Too Far Gone directly after The Voice. And I was scheduled to do a few more in Toronto. I had a big concert planned sometime this past summer, but clearly COVID, so that kind of deterred me just a little bit. But I still plan on doing it somehow, finding the new way to capture people's attention, especially being indie artists without the budget of, say, a label. But after The Voice, it was just, I won't say there was full sailing, but it definitely helped me to gain a bigger platform and just push things.
It was a nice catapult for you. So you became quite the little jet setter.
You can say that.
Yeah, well, I mean, it sounds to me like, oh, Canada, France, you know, I went here, went there, it's lovely. So what do you consider, aside from, you said something earlier with regards to learning more about yourself, and I understand that the song that you're going to be presenting has Creole in it, right? And so I identified you, I introduced you as Haitian American, and so what have you done differently now with your music that you weren't paying attention to before?
If anything, the real part of me. I mean, for the sake of this single, I want to say I wanted to dive more into the culture just a little bit. So it's a mix of English and Haitian Creole, but it was actually a South African producer. So it's a fusion of both our cultures into one. But outside of these, I guess, pop singles, just really be honest with the fans and be honest with the people. I don't think I've ever had a chance to do that musically. I've done that on my Instagram. Everybody, like, go live and I just talk about life. But musically, I never had a chance to do that. In this particular record, I wouldn't say I necessarily did that. I explored more of the flirtatious side of me a bit. But essentially, yeah, that'd be the best example of it.
You're like, well, you know, there's flirtatious side, you know.
It is, because it was so cookie cutter before, and I was talking about sad songs, and I thought to myself, well, nah, if anything, we have too much sadness and sorrow during COVID. Let me kind of explore other sides of me, and let me kind of showcase just a different energy. I think everybody else felt some type of way during COVID, so let's not do that. Let's take our mindset somewhere else.
And so before we go, how do you find that the industry is surviving amid this pandemic on a sales perspective, like especially as an indie artist?
It depends. As indies, we've had to work a lot harder and a lot smarter because, like I said, many of venues like Rockwood Music Hall or other venues have either switched online or just completely went out of business, you know? So for us as indies, it's been a bit difficult, but with platforms like TikTok and Instagram and knowing how to use that, it's helped. But it's been difficult, that I'll say, you know? But, you know, if you just put in the work, I'm a firm believer, if you put in the work and you put in the research, then all things will eventually fall into line. Have they fall completely in line? No, I wouldn't say so, but it's definitely on its way.
Well, you know, online and into line really is a matter of perspective, right?
Exactly.
We can talk about the prosperity in finances, or we can talk about the prosperity in self-identity. And it sounds to me like you're winning on both sides.
Thank you.
That's what's up. That's what's up. And we're so happy to have you back on the show to present it here in our Open Artist Spotlight.
Oh, I'm honored. I'm so hyped.
So are we. All right, but hang there, all right? Because we're going to take a quick break, and then we're going to come back to you, Zaxai. Woo! All right, you guys, we have to take a quick break, but when we return, Zaxai, he's going to perform for us, so don't go anywhere. Here now to perform an acoustic version of his world music single, Les Méchants. Please welcome Zaxai.
Check the scenario. You and I hit it all. Anything we say goes. Baby, I go fight for it. I go fight for you. Now you be the other. Say you want fresh water. I'll arrest the clouds to do. Till rain hits the ground to do. Your smile is my crown, baby. Your throne is my heart, baby. Come over and rule it. I want you to rule it, yes. I swear, wap koneki munweye jomwela. Son criminel bien habillé Kembela. That's what everybody says. How can I? When she knows damn well she méchant, toute ça fait méchant. Il fait qu'elle chavire, elle connaît où belle. Look how she glisten, walks with a mission. She's like sweet honeydew, caramel and sea ou miel. Gotcha, ma chérie, bien douce. Look how she sways, bien douce. Well, I told ya, it's about time we keep it real. If we are, you know the deal. My last name is yours, it's still I told ya. Just know that I'm on the way. Soon I'll make you comprehend. We say I same way, yes, so let go for me, baby. Won't you let go for me, baby? I'll be yours for life. I'm here for you, sugar. Box here for you, sugar. I swear, wap connecting one way, somewhere là. Son criminel bien habillé, Kembela. That's what everybody says. How can I? When she knows damn well, il méchant. Tout ça fait méchant. Il fait qu'elle chavire, elle connaît les belles. Look how she glistens, walks with a mission. She's like sweet honeydew, caramel and sea ou miel. Gotcha, ma chérie, whoa, bien douce. Look how she sways, whoa, bien douce. Les méchants, tout ça fait méchant. Chérie, 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 ou méchant.
Please make sure to follow him on Instagram at Zaxai_official. That is our show today, mi gente. Thanks to all our guests for coming through, and to you, our viewers, for tuning in. If you missed any part of the show, you can check out the rebroadcast tonight and 24 hours a day at bronxnet.tv. I'm Rhina Valentin. I'm from all of us here at Open. May the universe provide paz, prosperity, y amor. And where is my mask? Because I must remind you all, it is very important to continue wearing your mask.